Are there parts of the contract that people often underestimate but end up being important later on?
When a good matching program is involved, it is exceptionally rare that things go wrong. And I've been doing this I'm going on 18 years now. I have done this more times than I can count. And so I do really say that with confidence. It is very rare that things go wrong. When they do go wrong, they typically fall into one of three different categories. And the first one is management of pregnancy. So that involves everything from what the surrogate eats and the activities that she's going to engage in and her travel and whether or not this is something that randomly comes up from time to time if she has her own children who are in travel sports, how often she's leaving the state. That's a management of pregnancy issue. Management of pregnancy also includes her choice of doctors and her medical decisions. So it's her lifestyle and medical decisions. And again, things very rarely go wrong. When they do, management of pregnancy can come into play because the surrogate may have a different idea of how she wants to manage her pregnancy than the intended parents. Probably the best way to demonstrate that or to explain that would be by example. So very early in my career, I had a client who I will respectfully and affectionately refer to as a flower crown mama. Okay, this is the opposite of me. I was very high maintenance. All my kids came through the sunroof. But she was like, get me my crown. I will deliver in my living room. I mean, the best kind of mom, right? But on the other side, we had intended parents who were, they had just been through multiple heartbreaking failures and miscarriages and a stillbirth. And they wanted every high-level doctor and the most sterile OR. So it was a management of pregnancy issue, right? Nobody was right or wrong. It just wasn't the best match.
Yeah.
The most important provisions that a surrogate should watch out for would be her healthcare decisions, that she's able to choose her doctor. Again, I think it's reasonable that she choose a board-certified obstetrician or a certified nurse midwife under supervision of a board-certified obstetrician, and that she promised to follow doctor's instructions. That's a reasonable expectation. But having her choice of doctor subject to veto, for example, or a second opinion or substitution of her doctor, that would be a big red flag for me. Another big red flag for me are these really punitive provisions that have her, for example, paying back all the money that the intended parents have spent if she sleeps next to her cell phone.
Gotcha.
That's overly punitive. A court's not going to enforce that anyway. It's not productive for the parties.
Yeah, I would think that would make that whole process a little icky. Like, really?
Yeah, adversarial.
Yeah.